If you have back, butt, hip, or sciatica pain that is made worse the longer you walk or the longer you stand, but you feel good when you sit down and or when you lie down, well, you can't really live life lying down. So how are you going to be able to walk? How are you going to be able to function in the meantime? And so in this video, I'm going to share with you 2 simple tweaks or modifications that you can use to immediately improve the symptoms you're experiencing while walking. Now, obviously, this won't work for everyone. There's many things we could test, but for many of you, you will find relief. My name is Dr. Charlie Johnson. I'm a physical therapist. I have my board specialty in orthopedics, and I'm residency trained, which means this places me knowledge and experience-wise in the top 0.5% of physical therapy providers here in the U.S. alone. So I definitely don't know everything, but do have experience treating people like you, and I want to show you how we begin to solve this problem. Okay, so we can't avoid walking. So what do? Well, we tweak it or we change it. And the first tweak was something we call anti-sway, and the second one was leading with the hips, not the hip. Let's first talk about anti-sway. So if you have trouble standing and walking, chances are you have trouble doing a back bend motion. Now, how can I say this with such confidence? Because walking, as you walk and you kick your leg back, it kind of puts your back in that sway position. If I freeze and I stand up, I'm in the back bend position. So walking is essentially a back bend in disguise. And so if the back bend is painful, well, we know if we could free up the back bend or move you further away from the back bend, then we could improve your walking. So what you want to do first is anti-sway. So if you have pain while you're walking, again, this back bendy sensitivity might be part of the problem. So I want you to correct that. And you don't need to go full out and do this to the extreme, but start small and see how it feels. So what I want you to do first, I want you to take a walk and I want you to see what you experience. Get an idea of what that's like, how far you can go, where the symptoms are, and how bad the symptoms are on a 0 to maybe 100 scale. 0 is nothing, 100 is the worst ever. So let's just say right now you go for a little walk and you can get from here to there, wherever that may be, and it's a 50 out of 100. Now let's see if we can get you walking further with less symptoms. So picture the top of my belt line as the top of a bucket. All right, right now you can see the bucket is kind of tilted that way. All right, as if there was water in this bucket, it would be pouring out the front, or it would be headed that direction. Now what I want you to do is I want you to tilt the rim of the bucket backwards. All right, so you'll feel your abdominal muscles engage, all right, as you tilt backwards. Now, again, you don't need to go from this position to this position and walk around like that, just a little bit. So just there, just take a little bit of the sway back out. Anti-sway is the name of this tweak. Now, if you're having a hard time finding this position because, well, it's kind of an awkward motion, and maybe you have some stiffness in the front of your hips, so it feels hard to pull that back, go ahead, try to stand against a wall. Put your feet out about a foot or so. So picture that this line that you see right here is the wall. Stand against it, put my feet out a foot or so, and what you'll notice is that as you try to tuck, you'll feel your lower back starting to touch the wall. And so this starts to give you an external feedback mechanism to make sure that you're performing the anti-sway properly. All right, so that's the idea. So put your hand behind your back, your feet out about a foot or so, put your back on the wall, and just try to push your lower back into your hand or into the wall. See what that feels like. Then as you get the hang of doing that repeatedly, being here, tucking, tucking. Okay, now I'm getting the idea of what that's like. Dumping the bucket, the water in the bucket, out the back, or at least correcting it in this case, making it more upright. Then hold that position. Hold this position. Step away from the wall. And now you're walking in anti-sway versus this. So how a lot of people walk. Excessive arch. No big deal, not good or bad. But if you have a yucky back bend, you're going to have trouble walking. So let's take that out. Boom, anti-sway. There it is. So a little stiffness in the belly, and you can walk around like this. I could walk around like this all day. Not that I'm saying you have to do that, but again, you can become your own best anti-inflammatory. So you can take all the pills, take the steroid pack, do all that stuff. But what's it going to teach you? Not that much. You could be walking through your symptoms while you're on that medication. And then when it comes back, you're going to be no better off because you never took the time to do detective work to figure out why your problem there was there in the first place. But if you can connect the dots, ow, it makes sense, that's yucky. And no wonder all the press-ups I'm doing aren't working. That is a back bend repeatedly. But if I could take that out of the equation and I could go anti-sway, that's something then that I could apply, maybe not all the time, but if I need to be able to walk around the block. Try it on. And then again, the cool thing is that it easily becomes an exercise. Tweaks drop clues like cookies drop crumbs. Say that 10 times fast. So tweaks drop clues. Meaning if you find a tweak or a modification of the way that you move that works and makes you feel better, then why not multiply those better effects? Take that which the tweak is doing to your body or providing to your body, anti-sway, less back arch when you're walking, and say, how could I turn that into an exercise? We could do a lot of things. Honestly, I'll just make walking the exercise in an anti-sway, or make this the exercise. All right, get in this position, just hold it, and just practice that tucking maneuver over and over again. Or maybe it tells us that you're going to be someone who really likes doing forward motions, maybe seated, palming the floor, maybe pulling your knees up to your chest, things that take you out of that arched back position. Maybe you're someone who's going to love doing dead bugs, where you lay on your back. I'll put this in another video, where you lay on your back and you practice keeping anti-sway while you move your legs. The second thing is leading with the hips, not the head. For lots of people, maybe it's because this is what they've been told or just how they've developed over the years. You see this oftentimes in people who have more than 50 candles in their next birthday cake. Folks who are older and wiser, right? Whereby they're here, and over the years, they just do a little bit of this. So again, if you got that line behind me on the wall, you see that my ears, if I were to drop a line, are in front of my pelvis. Again, not necessarily good or bad, but guess who's having to work overtime? These puppies to hold me up. And so if you're in pain, you might want to try to get away from that pain by thinking, you know what? I got to lean forward, and that'll make it better. But leaning forward may actually make it worse. Because what's happening when you're leaning forward, you're activating lower back muscles. You're making them have to work harder than normal. The more they squeeze, the more they contract to keep you from falling flat on your face. The more they cut off the blood supply. And why do we care about cutting off blood supply? Because inside the blood is oxygen and nutrients that you need to heal. And if you cut it off because you're constantly squeezing them, unknowingly usually, out of habit, and you're walking like this, and that could be part of the problem. And so practice, maybe just look in a mirror. Practice pulling it underneath. I'm not saying arch it back. I'm just saying try to get things more aligned. Picture you're playing Jenga. This loses every time, right? Falls right over. Keep the blocks all stacked. And sometimes just that tweak and that awareness of, oh my gosh, I've been hurting for so long and I've been walking like this that if I just pull this underneath, I actually feel better. So think about anti-sway, leading with hips as if somebody has a rope on you and they're pulling you from the hips instead of from the head. Think of somebody pulling you from the hips instead of from the head. Anti-sway, leading with the hips, not the head, as two simple tweaks that you can apply to improve your walking. Again, how could you maybe turn that leading with the hips, not with the head, into an exercise? Well, you could simply just practice it. Maybe a little awareness check. Maybe you have a little rubber band, hips, not head. Maybe you have somebody throughout the day say, hey, it's your spouse, partner, significant other. Just randomly check in on me throughout the day as I'm walking. Let me know. Am I leading with my hips or am I leading with my head? Or you could practice starting from a squatted position, and instead of standing up like this to get on up, like so many of us do, and then leading with a back bend, ow, I wonder why getting up hurts. Why not start like this and picture someone's got a rope attached to your belt line. Hips, not head. Hips first, not head. More of a hip strategy than, I guess, a head strategy. So hopefully that was helpful. All right, let me know your thoughts in the comment. If you're looking for other tweaks to improve how you feel when you're walking, to reduce the back, butt, hip, or sciatica pain, you want to solve the problem naturally, be sure to check out my other video. Thanks so much. Chat soon.